Here, instantly, you may recognize this as being a lymph node because they pretty much all look like lymphoid blue cells, even at this point. And in some areas, you can see follicles towards the outside of the lymph node, which is the cortex. Certainly here, maybe here, maybe here. So you're thinking this is some kind of lymph node. And because towards the center of the lymph node, you see these sinuses, you think, well, this is maybe a kind of a normal lymph node. But you can see there's a large area which is not really that well defined. It's certainly all throughout here and maybe throughout here, in which you do not see normal structures. Around here, it looks like you have a reverse follicle where the lighter cells are on the inside, are on the outside, and the darker cells are on the inside, which is absolutely the opposite of what you normally see in a secondary nodule or secondary lymphoid follicle. So let's take a quick look. But before we do, let me tell you something. If you were to ask most pathologists, what do they spend half of their day doing? They'll probably say, oh, looking for metastatic tumor inside of lymph nodes. Because as you know, the presence of tumor within lymph nodes is of extremely important prognostic significance, and it may determine a vastly different type of therapy for the patient. And the art and trick of doing it is something that we all do, sometimes hours a day. I don't think anybody can deny that these are lymphoid cells. They're nice, round, small, and in some area we thought they were even forming little follicles. I don't think anybody would deny that these are lymphoid cells. But remember, we're in the good part of the lymph node. Now, we're still traveling around the lymph node, and we still think we kind of see lymphoid cells, but then we see these things over here as well, and we think, well, are these macrophages or are these some other kind of cell? They almost look epithelial. Epithelial cells are more cohesive and generally have more cytoplasm and more cohesiveness than lymphoid cells. Here are lymphoid cells. Here are the cells in question that look epithelial. They are, in fact, epithelial cells. And as you know, there should be no epithelial cells in a normal lymph node, because the only cells you have in a lymph node should be fibroblasts, blood vessels, plasma cells, lymphocytes, macrophages, but not epithelium. So whenever you see epithelium in a lymph node, even if it doesn't look like normal epithelium, or even if it doesn't look like a gland, which this may be a little bit of a gland over here, you can suspect that this is metastatic carcinoma. And that's exactly what we have here. We have metastatic carcinoma. And here are some more normal lymphoid cells, and here are some more epithelial cells. And look how much bigger the nuclei are in these epithelial cells, but they don't look terribly bad, do they? So let's zip over to another area. And in this area, it looks like there's a lot of lymphoid cells up here, but there might be a little patch of these epithelial cells, like here, 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 here. Here. This is metastatic carcinoma, and it could technically be from anywhere. Don't fall into the habit of trying to figure out where it came from. This is classically what metastatic breast cancer looks like, of course. If you were examining these as axillary nodes in a mastectomy and you saw cells that looked like this, you wouldn't have to make a big theoretical list that maybe these are from the colon or the lung. You know, these are metastatic breast carcinoma cells. Here's normal lymphocytes. All the rest of these are metastatic cells. Most of them look kind of individual. Some of them may have a little vacuole in them. Often, perhaps this is one. These are PAS positive. They're usually fairly specific for breast cancer, but you could see them in other places. Is this a little vacuole inside of a tumor cell as well? And the last thing I want to point out to you is that one reason why, if a lymph node is not obviously positive, and you think maybe there's just a little bit of tumor there, the very first place that you go to and to look at is the subcapsular sinus, because when you think of the anatomy of flow of cells into a lymph node from the afferents out through the efferents, the very first place tumor cells comes into is the subcapsular sinus. So a lot of times you'll see pathologists looking very closely at the periphery or the rim of a lymph node if most of the lymph node itself looks normal, because this is the very first place where tumor cells enter the lymph node by anatomic definition, is the subcapsular sinus. And of course, here's a follicle, but the sinus is between the follicle of the cortex and the capsule. And all of these are tumor cells. And let's take another look at these metastatic breast cells. I'll admit they don't look horribly pleomorphic or bizarre. Some of them do, like here or here. But just from the fact that they're epithelial, whether you do epithelial markers or breast markers, you'll see that they'll be positive. There should be no normal epithelium present in a lymph node. You know that this is metastatic carcinoma to a lymph node. And I thank you very much.